Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy, or you're just tired of not feeling like yourself, this space is for you. Welcome back to the Immune Edit. This week I'm going to share with you an email that I received, and I'm going to read it, and then we're going to dissect it a bit because this is interesting. Here's the email. We are pleased to offer a new individualized functional blood testing membership called blank. I'm going to leave the company out because I don't want to throw them under the bus. Unlike most blood tests that cost $1,000 to $2,000 and require a visit to a clinic to collect multiple vials of blood, we offer a painless at-home kit and access to AI-driven results for only $49 a month. This cutting-edge benefit includes 3 tests per year, results available within 48 hours, biological age-based on results, AI-driven supplement suggestions based on individual results, test panels that evaluate hormones, metabolism, insulin resistance, nutrient levels, and more. Access to high-quality supplements at group pricing. So that's the offering. Now let's break this down just a bit. Functional blood testing membership. Anytime you hear functional testing, you can think you're being sold something. A lot of times, these groups will try to almost demonize traditional medicine by saying we don't order enough tests or we don't understand the tests. We actually do. It's just a lot of what's being ordered are not validated. They're not scientifically proven. They may be a waste. Okay, if you're actually not going to do something with those results, or it's going to influence what you're going to do, we shouldn't be ordering the tests. It raises the cost a lot, which is why in this email it says, unlike most blood tests that cost $1,000 to $2,000 and require a visit to a clinic, they're painting that as a bad thing. That you're ordering a bunch of blood tests at $1,000 to $2,000 and requiring a visit to a clinic. Why would they require a clinic to a visit? Because in those instances, they may be requiring you to actually see a doctor to interpret those results. Well, what they're selling to you is you don't need the doctor anymore. We can just have AI interpret this. But the only thing that they're offering after that is $49 per month, but you only get 3 tests per year. So you're paying $49 a month for 3 tests for quarterly tests, basically. Then you're having AI-driven supplement suggestions. Let's go over that one. AI-driven supplement suggestions. Why does it have to be that? Because AI can't prescribe medication, and they're playing on the whole thing of supplements. Well, in a previous podcast, we talked about this issue of oversupplementation. So I think the thing that supplements mainly supplement are the manufacturer's income. I think that's mainly where it's driven. Because supplements do not have FDA oversight, so you truly don't know what you're getting, how much of what you're getting. They are not subjected to the high scrutiny that medicines are subjected to. So we don't have an accurate side effect profile. We don't have accurate research on what they're actually doing to you or for you in any clinically proven way. They will often say, well, research shows. What research? Who funded the research? Where did that come from? Can those results be reproducible? Are the results even statistically significant? These are often questions that are left unanswered. And even if you look on the supplement bottles, again, in a previous podcast, we referenced this, where on the cover, they'll have really nice colors, really nice marketing. They'll make some claims. And next to those claims about boosting your immune system and supporting your immune system, which are not scientific terms, by the way, we don't use those terms. Those are marketing terms. Next to those claims, there's going to be an asterisk. And then that asterisk, if you read the fine print, it's going to basically tell you it hasn't been approved or looked at or investigated by the FDA, and it's not intended to diagnose or treat anything. So again, it raises the question, what's the purpose of this? If they actually had legitimate research, and by the way, we know the research that's being done on this is really poor because at the end of the day, they're stuck with making claims of boosting and supporting, which again are marketing terms, not scientific terms. If they actually had legitimate evidence, I guarantee you, they would be telling you this is the legitimate evidence. It would specifically tell you this is what it's specifically doing to your immune system in a beneficial way. This is, and these are the specific risks. This is how it fared versus placebo. This is how it fared versus a different, perhaps, medication. You're never getting that kind of data from the supplement industry. Why? Because they don't have it. If they did, they would tell you, but they don't. So they're stuck with these hedge terms, this nonsense that's being out there. Now, am I saying I'm against every supplement that's out there? No, I'm not. I think there are targeted uh targeted vitamins, mineral supplements that can be used in certain circumstances, and in clinic I do recommend a number of these for specific reasons. Perhaps their vitamin D level is low. Perhaps their magnesium is low. Perhaps their vitamin B12 or folate or something else is deficient that we can prove. I don't need a proprietary blend of bullshit to give to somebody in order to supplement that. We can go after, really inexpensive, nice products that are on the market, but for specific reasons. Not some AI driven scheme to get you to buy their pharmaceutical or their nutraceuticals. So this particular email, for instance, is selling you two things. They're selling you on the tests. And by the way, this at-home kit that's painless, if it's not blood work, how is it painless? First of all, they're saying they have individualized functional blood testing. So there's going to be a needle involved. So I'm curious how they mention in one sentence that it's blood testing, and then in the next sentence, it's a painless at home kit. That doesn't make sense to me. There's going to be some pain involved if there's a needle involved, right? So how do they make that claim? But then next, it's like they're getting into so they're selling you on their kit, but then next, the point that they're making here is they're going to sell you their nutraceuticals that have no valid data to back any of it up. So what you're being sold here, that's packaged to you, is a whole lot of nothing. They're trying to remove thought. They're trying to remove uh, individualization to you. They're putting it in there with their AI driven individualized supplements based on your blood test results, but yet they're going to recommend products to you that I would be curious to know, how is there any clinical evidence to back that up? Again, I'm not saying this can't work or it doesn't work for some people. Just be aware of what you're being sold. Be aware, because you're being sold on two levels here: testing that's not validated and products that are not validated. Sometimes the medical industry gets a lot of bad rap. Pharmaceutical industries often will get a bad rap. And granted, I think there's a lot of overpricing that's happening in those situations. It also takes, I think, on average, $1 billion to get a drug to market nowadays because of all the regulation that's there. But that regulation that's there also monitors, it ensures there's stringent testing. in most cases, a placebo-controlled trials. Different phases of those clinical trials. There's phase 1, there's phase 2, there's phase 3, there's post-marketing. Every adverse reaction is reported to the FDA. It's scrutinized by the FDA. That is part of a package insert that can help educate you and make sure you're making an informed decision. In those package inserts, it will include the key clinical trials that actually show whether that product is safe and effective. And when they say safe and effective, does that mean completely devoid of side effect? No, it doesn't. There may be different side effects associated with that product, but at least they're transparent, they're listed, you're aware of those things. And then it comes down to, like everything in life, a risk benefit analysis. Is the potential risks of this product outweigh the benefit, or does the benefit of this product outweigh those risks? And the legitimate series of clinical trials through, primarily phase 2 and phase 3 clinical trials, post-marketing trials, that helps us make informed decisions. And we also know exactly what we're going to target and what we're going to go after. Not this generic, pay us $49 a month for quarterly tests that you're not going to see a doctor on, so that we can give you supplements that haven't been properly tested, haven't been properly vetted, don't have a FDA oversight, and really very little clinical evidence to support it. And again, we've talked about how we know there's not legitimate clinical evidence because they don't say it. If they had it, they would say it. Boosting, supporting, those are the red flag keywords. So that's the email that I got this week. And if you're going to spam email me from a company, you should kind of be careful of that, because I may take it down. That's it for the Immune Edit. What I would suggest for you is, again, pay attention to what you're being sold. Pay attention to what kind of marketing is there. Pay attention to more than just the headline. Read the actual articles. Read the actual meat. Think critically so that you're making the best decisions for you. Thank you. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.